Welcome back to Open Line tonight. We're talking about heart health, different ways you can stay heart healthy. It's your chance to ask questions of our guest, Misty Sharpe, Dr. Dan Munoz, both from Vanderbilt. Well, I should say Misty used to be at Vanderbilt just until recently. You've made a change. I've got to change that in my head. Now with the Adult Congenital Heart Association. So we're glad you're here. You're spreading awareness for them, but you'll never have that, never leave that nurse's hat behind, I'm sure.
No, not at all.
You're used to working with the little guys, and I do want to talk about that. I'll share a little bit with you. I knew nothing about congenital heart defects until I had my youngest son, who is now 3. His name is Decker, and he was born, we found out when he was a month old, with 2 congenital heart defects. And it has been a new path for us. It has been a lot of learning for us in the last 3 years. He had his first open heart surgery at 8 months old, and he's about to have another open heart surgery in about a month or so. So we, like many people, I'm sure you have learned this on your walk, that we had no idea that heart defects were so common. 1 in 100 babies, that's about 40,000 babies a year here in the United States. But gosh, it's just not talked about that much. Why is that, Misty? Any ideas?
You know, I think that it's just that, again, the fact that when you have surgery, there's that misconception that people are fixed and they're cured. And we're seeing now with the adult side that there's actually more adults living with congenital heart defects than children. But statistically, less than 10% of those adults are in care, and in inappropriate care, if any care at all. And I just think that it's just kind of a mixture of misconceptions that that lifelong care is not required.
So you think that these adults, who are once children with heart defects, they know that they have something wrong with their heart, they just perhaps don't know that they still need care for it, or they don't know where to turn?
I think it's a mixture of both. So in my daily work, I kind of see both. And I work with a group of volunteers called our ambassadors that are patients and family members, and they have all sorts of experiences, from being able to go from pediatric to adult care seamlessly to those that have been lost to care for 30 years.
Wow.
And I think that's the same thing in the community, is that a lot of times when I talk to people, they say, well, I thought I was fixed, I had surgery, so I didn't think that I needed care. But I think that the big thing is knowing that we know that people see cardiologists as a child. At 18, when they turn an adult, it doesn't magically go away.
Sure, sure. And you have a very personal, I know it's a bit painful to talk about, your nephew Drew, who had congenital heart defects and has died.
Yes.
And he kind of lost that care, right, for a little while?
Right, yes. So he was 20 years old, and he had surgery when he was, of course, a baby, had several surgeries then, but had surgeries as a teenager as well too, when he was around 17. And just kind of that transition into adulthood, and there not being kind of a designated center in the area that he was lost to care for less than 2 years, never showed any signs that anything was wrong, and went to play soccer with some of his friends one morning and just collapsed on the soccer field, and unfortunately was unable to be revived. And so, you know, you hear about these stories all the time of that happening with people with undiagnosed defects. But even in the CHD world, you know, there's kids and adults that have a checkup, and they have a great checkup, and then a month or 2 later, they have an event. And so it's so unpredictable.
Yes, very much so. Let's jump to the lines, because this is what this show is all about. We have Michael holding on the line. Michael, thanks for being part of the show. Do you have a question tonight?
I do. I had a stroke about 7 months ago. I seem to be recuperating quite well, but my heart is in AFib, and I was just wondering what I should do about it, or should I do anything about it?
Okay, Dr. Munoz, that sounds like a question for you.
Sure. So thanks for the call and the question. So certainly, for all the reasons that you just shared with us, it's important that you be plugged into good care, probably with a neurologist for your stroke, but also for heart care, because oftentimes there is a link between heart conditions and strokes. There are certain heart conditions like AFib that can raise somebody's risk of a stroke. And so, well, I don't want to give you direct medical advice, because I think that's best given by your doctor. I would urge you, if you're not already, to see a cardiologist and ask specifically about whether there are certain medications or certain approaches that would be necessary and appropriate in your situation, given what you've been through. And I hope that you continue to recover from the event 7 months ago.
Can you explain that link between stroke and heart disease?
You bet. So perhaps the most common form of stroke in adults is when a blood clot travels, usually from the heart up to the brain, and then gets lodged somewhere and causes an interruption in blood flow to a key portion of the brain. There are certain things that can cause blood clots to form, but by far the most common is, as that caller noted, atrial fibrillation, or AFib, when the top chambers of the heart don't beat quite like they should, and that can lead to a risk of blood clot forming. And whenever blood clots form in the body, it concerns us, and particularly in the heart, when they decide to travel up the highway, it can cause stroke. And so AFib is very common, but it's also, when identified, an opportunity to really lower somebody's risk of having a stroke down the road or a subsequent stroke. And there are all kinds of medication-based approaches, including blood thinners when appropriate, that can help to prevent that from happening again.
Okay, great information. We also have Lucy on the line. Lucy, thanks for being part of the show tonight. What's your question or comment?
Yes, ma'am. I have two questions.
Okay.
One is about being not diagnosed with a hole in your heart until you're older. Is that common, or is it harder to find as you age, the hole in the heart? And the second one is heart disease, like valve disease, in relation to the strep bacteria from dental procedures. Say if you had a abscess tooth. I'll hang up and take your answers off the air.
Okay, thank you, Lucy, for calling in. Let's tackle that first one.
Sure. So the first question was about a hole in the heart.
Yes.
So there are 4 chambers to the normal adult heart, and there can be abnormal connections between those chambers. Some sort of holes in the heart are small enough that they're not of any consequence and can be found by chance on a routine test. And oftentimes it'll just require monitoring going forward. It doesn't mean that you need to have a surgery necessarily. There are some connections that are abnormal enough or big enough that it does require at least consideration of certain procedures. And so I think the main thing would be to ensure that you're plugged in with a good doctor, a good cardiologist if appropriate, to really go through a discussion of what's needed in your specific situation. The second question was about bacterial infections and dental procedures. So, so good dental care is actually good heart care, as it turns out. And so for the general population without any known heart disease, the key is to get good dental care, and there isn't anything heart specific that somebody needs aside from good dental care in the case of, say, a tooth infection or an abscess, as your caller noted. There are certain patients, certain heart patients, who have gone through valve procedures, who have gone through certain cardiac specific procedures, who might be at increased risk compared to the general population of developing a heart infection as a result of, say, a tooth abscess or a different kind of infection. And so there are certain populations, certain parts of the population, certain people who, when undergoing, for example, a dental procedure, we will recommend as heart doctors an antibiotic or antibiotics in a preventive way to try to protect a valve or protect certain parts of the heart. Again, that is a very case-by-case situation, and so the key is to really consult. If you have concerns about a prior heart issue going into, say, a dental procedure, is to ask your heart doctor in advance as to whether antibiotics, for example, are an appropriate step to take for defense.
What is the link between dental health and heart health? I mean, I was just at the dentist this morning with my young ones, and I was talking to the dentist about this, and he said, well, let's get a good look at his gums and see how they're doing right now. And, because that's part of how his heart is doing. So what is the link?
Yeah, it's a great question. So our bodies, or the inside of our bodies, are in sort of a constant state of cleaning, where bacteria that tries to enter our bloodstream or the rest of our bodies, our body's immune system or defense mechanisms really tackles those bacteria and spits them out, so to speak. One of the main places where bacteria enter our body every day, no matter how many times we brush our teeth, is the mouth.
Makes sense.
And so if that is exacerbated by an infection, where a tooth becomes infected and more bacteria is able to enter your bloodstream, it can reach a certain point where that bacteria can last long enough to cling to certain things, including heart valves. It doesn't happen often, but when it does, the consequences can be significant. And so we really try to prevent that rather than react to it. And when we need to react to it, we do. but much better to prevent it than to react to it.
Sure. So again, it's just that constant conversation that you need to have with your cardiologist if you know you're in this boat.
That's right.
All right. We're going to take another quick break. Thank you for your calls, both to Michael and Lucy. We're taking more calls. You can call during the break. Taylor will get you lined up. 615-737+ is the number to call. We're coming right back.